It really is, especially in the case of the obvious type 1 versus type 2. A type 1 diabetic has to get insulin injections. There's no alternative. They don't have it. And they will not have a healthy, long life if they don't have insulin. In the case of a type 2 diabetic, because we look at them both as glucose problems and we say, well, insulin works for the type 1, so insulin will work for the type 2. And yet most type 2 diabetics have insulin and in fact have elevated levels of insulin. And giving the type 2 diabetic insulin kills them faster. And they're swimming in a sea of insulin. And we know this. Treating a type 2 diabetic, they're more likely to die from heart disease. They're more likely to die from cancer. And overall mortality is up. And so there really is no better analogy, but giving a type 2 diabetic insulin and hoping it will help them is like giving an alcoholic another glass of wine, hoping that will help them. It's the alcohol that's caused the alcoholism. It's the insulin that has caused the type 2 diabetes. There's too much of it. And so when we focus on glucose rather than insulin in the type 2 diabetic, we're trying to control their glucose levels. And we say, well, who cares if we give them more insulin? We don't care about insulin. We care about the glucose. That's conventional medicine. And yet, by doing so, we are killing them faster by focusing on glucose control. And second, and this is important, by focusing on the glucose, we miss the disease up to 10 or 20 years later, where if we looked at insulin as the marker of the disease, then we could detect that much sooner, decades potentially, before the glucose has ever changed, because they're eating a diet that's increasing their insulin over time, but they're sensitive enough to their own insulin they can keep their glucose in control. Then they keep getting more and more resistant to their insulin, so they have to have more and more and more of it. But it's still enough to keep the glucose in control. And then eventually, they're so resistant to their own insulin that they can't make enough. They've reached their limit of how much insulin they can make. And then, and only then, does the glucose start to climb up. Oh, now we detect the problem, and now we put you on insulin or whatever. And it's because we're chasing glucose. And if we looked at type 2 diabetes as an insulin problem, oh boy, then we're detecting it and treating it very, very differently, and I would argue significantly better by using glucose as the marker of interest.
And the problem there, Drew, of course, is that nowadays, because people have been told you need to eat a high-carb diet filled with starches and even sugars, unfortunately, and you need to eat every 2 hours or so. We're told to eat 6 mini meals per day. That means from the moment the person wakes up, they spike their glucose and the insulin follows. And, 2 or so hours later, when the insulin, the glucose is coming back down to normal, we bump it back up again. We bump it back up again. So the average person is spending every waking moment from within minutes of waking up to well past the time they've gone to bed with elevated insulin. That is back to that glucose insulin paradigm. So someone who's constantly spiking their glucose is constantly spiking their insulin. And the insulin will lag behind. So you and I are wearing our continuous glucose monitors. We'll see our glucose come up and down. Let's just say it gets back to normal within 2 hours. Insulin doesn't come down that quickly. Its effects will linger, and it will then slowly come down after the glucose. So eventually, the person gets to a state where this incessant stimulus with insulin starts to make the body resistant to insulin, because that is a fundamental principle of biology. Too much of something will result in a resistance to that something. So as the body is swimming in a sea of insulin, insulin's always elevated, it starts to need more and more insulin to get the same effect. But then we get to this paradigm that I said I'd come back to, where the person has normal glucose levels, but they have vastly elevated insulin. This right here is a perfect kind of textbook state of insulin resistance. Insulin is working well enough, despite needing several times more than we had before, to keep the glucose at a normal level. Unfortunately, because we look at metabolic health almost strictly through the lens of glucose control, we have the patient coming in year after year, and we see that their glucose is normal. Glucose is normal, so you're fine. You don't have any metabolic problems. But if we shifted this paradigm away from the glucose-centric model to appreciate the relevance of insulin, we would have detected 10 or 20 years earlier that the insulin is several times higher than it should be. But then we only detect the problem once the body has become so resistant to its own insulin that insulin can no longer keep glucose in check, and now the glucose starts to climb. Now we detect the problem clinically. Now we diagnose them as having some metabolic problem like type 2 diabetes. So the track back to the fat cell, a fat cell becomes insulin resistant when it gets too big. When an individual fat cell has grown to about 4 or 5 times bigger than a normal fat cell, it becomes insulin resistant. It's basically telling the insulin, you want me to continue to grow. I cannot. I have reached a maximum size beyond which I will explode. So I'm going to stop listening to you. I'm going to become insulin resistant. You're telling me to continue to grow. I am now going to start leaking out fat when I shouldn't, because high insulin would prevent a fat cell from leaking or breaking down its fat to share with other cells into the blood to be used by the body. The fat cell becomes insulin resistant. As to your point, I think we can say a survival mechanism. If it gets too big, it will burst, and that will, of course, be a very harmful process to the body. It's a very messy thing when cells explode, when they undergo this kind of necrosis or this ugly death. So the fat cell becomes insulin resistant. In so doing, like I said, it starts leaking fats, and it starts leaking these pro-inflammatory proteins called cytokines that we mentioned at the very outset of our conversation. It's doing that, again, to try to survive, because one of the effects of some of these cytokines is to increase blood flow through a tissue. So the fat cell, which has gotten so big.
So when people get insulin resistance, what's happening is that their pancreas is working way harder than it needs to in response to the carbohydrates that they're eating. Okay. So they eat carbohydrate, they digest it, it's sugar in your blood, so your body has to put that somewhere. It can't hang out in the blood the whole time. So insulin comes in, takes that sugar out of the blood and puts it into your cells. So what'll happen though is people will eat the carbohydrates and they eat, more and more and more, and then the pancreas starts making more and more insulin because the cells are starting to ignore the signal. Right. So it's almost like the cells are inside and the insulin's knocking at the door, and it's happening so often that the cells are like, oh, just leave me alone, and they start to ignore it. And then after a while, it's like you don't hear it anymore. So then the pancreas is like, okay, nobody's listening, I need to make more insulin. So then the amount of insulin that you're making just keeps going up and up and up. And eventually the pancreas can't keep doing that. It's going to start to burn out. And that's where we get diabetes.
What kinds of symptoms then would somebody experience if they were having insulin resistance?
So a lot of people will actually get hypoglycemic symptoms first. So if they haven't eaten for a while, they'll start to get headaches, they'll start to get cranky, they'll start to feel a little dizzy. A big one is the weight will start to come on around the middle. So we'll call that central obesity or truncal obesity. A lot of inflammation people will start to get. Probably another one that's common but may not be totally related to insulin resistance is the sleep starts to get disrupted. So they frequently, it's not falling asleep they have the issue with, it's more staying asleep. So they start waking up in the middle of the night. And commonly people are waking up at the same time every night. So between that 1 to 3 in the morning.
Like wake.
I think we should care because it's such an underlying kind of root for so many different inflammatory conditions that are happening in the body. And inflammation is really the root of chronic disease. So if you want to stay healthy, you want to live an active life, you want to feel good, you don't want to be spending your last kind of 20 years in a nursing home, you want to actually have some vitality, treating that chronic inflammation is really key.
Right. Okay, so can somebody have insulin resistance and not be overweight? Do you ever see that?
Absolutely. Same thing as people can be diabetic and not be overweight. So people are like shocked, oh my God, this person has diabetes, you're not overweight. But it all has to do with the pancreas and how it's responding to the amount of carbohydrate you're eating.
So what would somebody feel if they didn't present with that classic kind of weight gain around the middle, tired, that kind of thing? What would they maybe present with if they were insulin resistant but thin?
Maybe they would just have chronic inflammation. So they've got inflammation in all their joints.
Right.
Yeah.
Okay.
Yeah. Or maybe just one joint. Yeah. Yeah.
So how would you diagnose insulin resistance with your patients if somebody came into your office complaining of all of these classic symptoms?
Yeah, so the most common test that I'm doing right now with people is a blood test.
Yeah.
And we call it a reactive insulin test. So you can't really know what an organ's doing unless you stress it. Right?
Okay, yeah.
So same idea is like you run like a heart rate monitor on someone, but you don't want them to just be sitting the whole time you're running it. You want them to actually be doing some activity so you can see whether there's any abnormalities. Same type of idea with the pancreas. So to stress the pancreas, you have to eat a high carb meal. So the example in the studies would be pancakes, syrup, and a little bit of like a small glass of orange juice.
And what we're eating for breakfast all the time.
Yeah, traditional breakfast food, right? So if people don't want to eat the pancakes, I often say, okay, just do a bowl of oatmeal. So you'll get the same effect on the pancreas. So then 2 hours later, you would go and get your blood work done, and that's where we would measure the insulin. So when I first started doing this test, I didn't expect some of the results that I've actually been getting back. So
what have you seen?
It's kind of crazy, actually. So anything under 240 would be considered normal. If you're above 340, then for sure you have insulin resistance. If you're above 550, you have severe insulin resistance. And I'm getting numbers back in the thousands and 2000s with some people.
What I'm about to say is the most important thing that I'm going to say in this video. So this is really important, folks. The one thing proven to reduce insulin levels the most is fasting. Going without food by mouth for a period of time. In my Butter Makes Your Pants Fall Off video, I talked about a low-carb, high-fat diet. And I talked about how that type of diet keeps your insulin lower and turns down your appetite so you can go hours and hours without eating. Hours without being hungry. And without using your willpower at all. The appetite control that a low-carb, high-fat diet gives you makes it easy to fast because you're just not hungry. Low-carb, high-fat imitates fasting itself because both the low-carb, high-fat diet and going without food or fasting, both of these, cause the body to burn fat as an energy source. Low-carb, high-fat is using fat from food for energy. Fasting is your body using body fat for food. The problem that people have on this diet is this. They think the fatty foods are the cure. In other words, they believe it is eating butter and other fats that are the magic cure. Of course, eating fatty foods will prevent you from spiking your insulin. So that's good. But more importantly, fatty foods will keep you satisfied longer and allow your body to remain in fat burning mode, which will keep your appetite under complete control, allowing you to eat less often. This eating less often is the real cure to your chronically high insulin problem. And this eating less often is called intermittent fasting, short-term fasting. Not eating less food, but eating your food less often, allowing most of the time each day without eating. The problem is chronically high or constantly high insulin. Never allowing the body a rest from chronically high insulin levels is the root of our tree. Now listen, while you're fasting, you should drink water for sure. And you can have some clear broth, and you can drink a fatty coffee or a fatty tea, whatever your preference is. While you're fasting, that's not going to hurt your fast. So that's something that you can do on your fasting times. Keep it simple and don't eat when not hungry. This will begin the process of drying up the root of chronically high insulin levels. As insulin levels are kept chronically lower most of the time, the processes going on in the trunk of our tree start to reverse. The body takes the fat out of the liver first. Without this fat, the liver becomes less resistant to insulin. The liver greatly reduces the amount of triglycerides in your blood. It's one of the most noticeable things we see on this diet. As the triglycerides come down, Often we find that the good HDL cholesterol begins to go up. As the liver fat comes down, blood sugars begin to normalize. As the belly fat starts to reduce, the inflammation in the body, coming from the fat cells themselves, begins to be reduced. Your arteries stop being damaged. The joints start to heal. Blood becomes thinner. Your body starts being able to break up clots again.
They should. And we're eating later, so most of the calories are consumed before noon, and you can see that we're eating all the time as well. So the median daily eating duration is 14 hours and 45 minutes. That's the average, right? That's the median, I should say, of everybody. So if you started eating at 8 a.m., you wouldn't stop until 10:45 p.m. That's the 50th percentile, right? A lot of people are eating more than that. They're starting at 7 a.m. and not stopping until 11 p.m. So the only time we're not eating is when we're sleeping. And that's one of the big problems, because you know that every time you eat, your insulin is going to go up, assuming you're eating a mixed meal. And the insulin is actually a hormone that tells your body to store food energy, right? I mean, the whole problem of obesity is not really all that difficult. If insulin goes up, your body is supposed to store that food energy. When you don't eat, when you fast, then your body is supposed to take that food energy back out and burn it. And that's the reason that you don't die in your sleep every single night. It's because you store it and then use it, right?
The next factor is to empty the bucket. Empty the bucket. What is the bucket? The bucket is our body's store of glycogen, which is stored sugar. And that bucket is in the liver and in the muscles. Our liver and our muscles are filled with about 2,000 calories worth of sugar in the form of glycogen. And that's used for quick energy. The problem is if we never use it, if we don't empty the bucket, when we eat more carbohydrate, sugar, or even protein, which gets converted to sugar, it's got nowhere to go. So it just spills over into the bloodstream. So we've got to empty the bucket. How do we do that? Exercise, particularly high intensity, short burst interval training. You've got to deplete the glycogen stores in the muscle and the liver. The only way to do that is through anaerobic exercise, which is exercise where you're huffing and puffing and breathing heavy, high intensity, you're getting close to your maximum heart rate. And you do that for short bursts of time, 30 seconds or a minute. And we've got some special videos of that coming up. Now, I will give a word of caution. If you're new to that type of exercise, make sure your heart healthy, check with your doctor, and ramp up to that.